France's Prime Minister Jean Castex has warned people not to expect the lifting or relaxing of lockdown restrictions that have been aimed at curbing the spread of the virus. Despite some positive signs towards slowing the infection rate, COVID-19 patients currently make up 95% of intensive care admissions in the country. And France isn't alone. Health systems across the continent are buckling under the pressure of the pandemic. Oscar Valero reports.
The legendary race circuit of Monza, set up like a health facility, is the vivid image of the overwhelming second wave of COVID in Italy. From north to south, from Lombardy to here in Naples, hospitals are crowded, no more beds available. Ambulances are parked right outside the building as improvised rooms to keep taking care of patients.
The current situation at the hospital is that we have almost no more beds available. We're working intensively with sacrifice and taking great responsibility, particularly with the workers and the nurses. Seeing nurses running to cars outside the perimeter of the hospital to take care of patients with oxygen cylinders make me proud.
The second wave is hitting France very hard as well. 2 weeks into the confinement, cases are slowly declining, but the situation is still critical. So the lockdown will be maintained for at least 15 more days.
If we consider a 7-day average, we observe a 16% decrease. This change must be interpreted in a manner that's positive but prudent. These last few days we have tallied one hospitalization every 30 seconds and an ICU admission every 3 minutes. 40% of people admitted to intensive care are under 65 years old. This is obviously significant, and the number of hospitalizations have surpassed the April peak.
Switzerland had to call its army to enhance its hospital's workforce. Up to 2,500 military personnel will help doctors and nurses in controlling a spike that has produced 7,000 cases and 93 dead in the last 24 hours.